So first of all, today I will share you about the Thai traditional medicine approach for the NCD diseases. First, I would like to introduce our center. So our center is the first university in Thailand that we have the curriculum about the Thai traditional medicine. And now we are the WHO collaborating center for the traditional medicine in Thailand. We provide the primary to the tertiary healthcare services about the traditional medicines, and we are integrated with the IPD and other health professional. And we have our manufacturing unit for the production of the herbal medicine and products. And our curriculum is accredited by the AUNQA, and we are the member of the Global University Network of Traditional Medicine, that there are many universities that teach about traditional medicine around the world join together. And for today, my presentation is include that first of all, I would like to introduce about our basic concept of traditional medicine and what we do for the NCDs. And I will give you some example cases for the NCD. Let me introduce yours about our basic concept. So in our theory, we are observe our body compare with the nature, and we have the four elements, that is earth, water, wind, and fire. So let's think in the Western concept, like the earth is the blood vessel. It's just like the structure of the body. And in the blood vessel, we have the water. The blood is the water, and how the water can movement is moved because of the wind element. And when the blood is movement, they have the energy. So that energy is the fire elements. This one is like the basic example about the four elements in our body, what they working together. And when the body elements is imbalance, we will get sick. And what is the factor for us to get sick? We have like the external factor and internal factors. That the factor caused by our body element itself, or maybe the age change. We got sick differently in each age. Our behavior, or we affect from the season, the time, or the weather, or any accidental. So it make the body element imbalance, just like something get increased, something decrease, or maybe disabled to do the function. And how we taking care of the patient, we have the guideline that we start by the history tracking with the physical examination, and we also can consult with the conventional doctor to investigate more in specific labs. And next, we diagnose by our own theory and give the treatment based on traditional medicines. We have the follow-up scenario, and also we do the refer to the specialist if the disease is not get better or it get worse. This is the basic concept about our traditional medicine to taking care for the patient. And how about our roles to the NCDs? The most prevalent NCD in Thailand, we have like diabetes, cancer, hypertension, stroke, any CVD disease or CRD disease. So the role of us in the NCD, we can have in the preventive state, like prevent for diseases by giving the health promotion, any treatment based on Thai traditional medicine, even though adjust the behavior or based on our body elements. But if you get sick already, or like in the early detection state, we give the supportive treatment. Maybe we use the herbal medicine or do any maneuvers for that state. But for the long-term care, because of in this group, patient get sick for like a long time. So we can management in the chronic diseases. We have a role in palliative care, and also we consulting the patient using our traditional medicine concept. And in Thailand, specialists in our hospital, we work together with Western medicine and other health profession as the integrative medicines by under the quality, safety, and efficacy to the patients. So this one is how we do the management for the NCD diseases. Next, I will give you some example case. First, I will start with the diabetes. For the traditional medicine, we say that the diabetes is like the patient having like a sweet urine. In our scripture, it writing that the patient has the urine and the end is coming. And in scripture, we writing the disease name likeมูดตังพิการ or เบาหวาน it's just like a sweet urine. So we can compare these diseases to the Western concept that in the Western medicines, when you diagnose the DM, you follow by the glucose blood check and also like finding out more etiologies in that way. And in our pathophysiology, we think that the cause of this disease is coming of the fire element is imbalance because of the fire element that like a digestive fire cannot do properly. So the waste from the food that we eat that like a sweet or the glucose is coming up a lot, and then it affect to the wind and the water. So the wind cannot flow properly. The water will become more because of the fire cannot control the water, and it show to the organs. Finally, they show to the organs, so it affect to the earth. And when we treat them, we need to rebalance by like finding out the cause of disease. If we need to adjust from the fire element, we need to prescribe like a little bit of bitter and cold test. For the herbal medicine, we need to stimulate the wind because of the wind cannot flow properly. So we give some herbal medicine. We do some manuals like a hot compress, doing some massage or the foot bath. And if the water is a lot, we need to let the water secreting out. So we prescribe some herbal medicine that remove the water. This is like the basic concept that we treat for the diabetes mellitus. And we also working together with the interdisciplinary disease, the team that has like a nurse, doctor, or like a pharmacist, physiologist. So we have like a course training together, and in this course, all health profession learn how to approach to the patient and how to encourage them to change their lifestyle, how they can live with the DM for the longer time. So this one is the example team that we do with the DM patient. And this is the case example. The patient who has the DM for a long time, more than 10 years, and she visit us at our clinic with the sharp pain in the leg and feet. And she feel a little bit of like a burn and a numbness and feeling cramp. So when we do the physical examination, we got the like a pitting edema, the positive test of the pinprick test, but they no wound on leg and feet. And the fasting blood sugar is about like 150, so it's not good enough. So in this one, the cause of disease of this patient is because of her behavior. She eats a lot of the sweet, she eat a lot of the salt, so it affect for her elements. So how we treat her, we prescribe her herbal medicine. We advise for like the food that she can have, any like a behavior change and exercise. And we also give her a massage to relieve the pain or the numbness. And we give her a foot bath. But we also still let her still take the anti-hyperglycemic drug. So the outcome for after 4 weeks, the result is feeling better, but we didn't follow up about the fasting blood sugar. This is the example of the exercise that we recommend to her, like do the easy aerobic exercise in her house. The food recommend for her, like increase more herb or vegetable in her daily life diet. So this is the example dishes that we recommend to her. And follow this one, we have some the research that confirm or like supported the maneuver in these cases. So when the patient has the neuropathic pain, the effect of the massage will relieve her pain. And also the foot bath can relieve the numbness. And we also have the like our traditional herbal recipe we call Mathura Meha formula. In this one, we have the research that the patient who has the Mathura Meha with the anti-hyperglycemic drug getting better blood sugar more than the anti-hyperglycemic drug only. And some food or vegetable or the herb in daily life that we recommend to them, they have some research show that the fruit and the leaf of the moringa, or in Thai we call marum, can help for the diabetes. And this one is another example for the herb that we can find in Thailand that she can eat for her diabetes. So the summary of our role in the DM management is just like the supportive way by using the herb, using the manuals and the behavioral adjustment. Another case example is the cancer. In Thai, we have the cancer in our menu scripture, but the cancer in the scripture is different from cancer in the conventional medicine. In Thai, cancer is mean like the chronic diseases. Usually, maybe it might be about the skin disease or about the inflammation. So the word cancer or mareng in Thai is not at all the tumor. And how we do with like the case of the tumor or the cancer? We do as only the supportive way because of the herbal medicine or non-herbal medicine just relieve the symptom that come along with the cancer, like the symptom with nauseating, constipation, pain, fatigue, insomnia, or any stress or anxiety. But we didn't treat directly to reduce the cell of the cancer. And this one is the way that we recommend them to do by themselves, like adjust their behavior, let their mind better by doing under their own believing and exercise. And because of the cancer patient, a lot coming to the palliative state. So we work with another multidisciplinary in the palliative ward. And we also work along with the monk because of in Thailand we have the main religion is the Buddhist. So a lot of the patient in our ward, like when the end of their life or when they want to prepare to the end of their life, we invited the monk as the one of the multidisciplinary team to taking care the cancer patient together. Sometimes you will see like a one patient in one scenario, like a nurse coming and taking care about like a drug or the medicine that the patient having. Our doctor doing any soft or light massage or teaching the caregiver to taking care about the pain or any anxiety to the patient. And sometimes we have like the music therapist coming together, play a song along when we giving the treatment. And not only for this group, not only taking care the patient, we also have the project that taking care about the caregiver, not only the relative, but also another staff in this team. We come together, we call like a healing to the healer to reboot our staff and our caregiver. So the example case is like this case, he has the bone metastatic cancer and the doctor just consult of the knee pain. He has like a swelling, like a lot of inflame at the knee. So our doctor giving like massage and the herbal paste that is the very cold taste to the knee, just like this, as you see on the slide, to reduce the inflammation and relieve the pain for the patient. So this one is our research article that we conclude about our multidisciplinary team for the palliative care. So we do all for the physical, social, and the spirit. And the last case that I will show to you is the stroke. In Thai, we have a lot of the stroke patient. So in stroke, it's just like because of the wind in the body is imbalance, just like the wind going upward and downward, not balanced. So we need to taking care about this one. So in the stroke patients, special in the stroke ward, we working together with the multidisciplinary team. We have the goal planning together in the team. So what we do for the stroke, we can help in the pain, weakness, dizziness, any constipation, swelling, do for the muscle spasm or maybe the joint stiffness. So this one is the way that we treat the patient. But if the patient has the warfarin or any anticoagulant medicine, we need to check the INR. It must be no greater than 3. So if it's greater than 3, we don't do the maneuver for them. So the framework for the IMC for about our traditional medicine, if in the hospital, we working in the multidisciplinary team, in the rehabilitation ward or geriatric ward or the primary care unit. And in the community ways, we have the home health care visit. We going out, visit the patient house. Let's see what they stay in their house. Do they need any help or not? And we also had a community care, like the van service to the community, because sometimes a lot of the patient cannot come to the hospital easily. So we put our clinic, the station into the community. So this case is the case that has the right side weakness for the 2 weeks. Now he stay in the post-stroke ward. So after remove all the cause of the disease, So he get recovery in the ward. He has the numbness and weakness and the spasticity. So we do the massage for him and like a help to rehabilitation for the patient. And giving him like a doing the exercise on the bed, easy exercise. And in this case, he also has the physical therapy treatment and also occupational treatment together. And for the patient who have like a after surgery, we can massage at the abdomen area to help them for the constipation, like a stimulate the GI tract. So also the stroke we do as the supportive treatment. So the summary of our role in the NCD is just like for prevention as the health promotion treatment. We do the supportive treatment in the curative way. And for the long-term care, we do for the chronic management, educational consulting, and the palliative care together with the standard treatment. So we not let the patient stop the standard treatment. We let them go on with the standard treatment, but add the traditional medicine work together to improve their quality of life. So at the end, I would like to say that the Thai traditional medicine is the art, just not only for the massage or not only the herb, but it's the art for treating, enhancing, and preventing and rehabilitating health with the Thai wisdom, Thai culture, and Thai way of life. Thank you.
Thank you, Dr. Katie. Please give applause to Dr. Katie. Okay, I will resume your material. Your talk highlight about TTM offers or Thai traditional offers integrative approach for managing non-communicable disease in Thailand with basic concept revolve around balancing body elements and therefore elements it's earth, water, wind and fire and including internal and external factors. And you say that it's how medicine compared to Western medicine. And in the end, you say that TTM is art, TTM is not massage, and TTM is not herb. Okay, thank you very much, Dr. Katie. And we hope you still in the Zoom because we still have two presenters before we continue to question and answer session. Kapun kap, Dr. Katie.
Hello, everyone. Thank you so much. It's an honor for me to be here. And I would like to say once more, good morning to all the honorable speakers and the honorable participant. And of course, my deep gratitude that I'm allowed and have an opportunity to share about European medicinal plants here. So, like what is the MC just share? My name is Lisa. I'm Indonesian that living in Germany for the past 15 years. And since like 5 years ago during the pandemic era, I growth interest about Indonesian medicinal drinks that called Jamu. This is a very famous and popular back then in Indonesia and surprisingly in the world that time. So then during the pandemic, everybody starting to consume the medicinal herbal. And I was thinking how similar all these habits with my hometown, or Indonesia. I grew up and born in Jakarta, but even that I'm here outside of my country, deep down, I'm still Indonesian. So And then I saw that we can go to the next slide, please. Then I saw that a very interesting fact that the way they are using it, it's likely most the same, but the packing are so different. So the packing and I don't know what we call that, the belief also it's different, and it's I need to highlight one point: the quality of the product is also very advanced, and this is what I would like to highlight. So some points that I like to share today is like introduction to the European herbs. I think everybody know about this, the benefit of herbs for the metabolics, and types of the European herbs, and the using of the European herbs, and integrating European herbs into a healthy lifestyle. Next slide, please. So as we all know, the European herbal, the history of the tradition is divided into some part. Long time ago, I think in the Romance and Greek centuries, influence a lot of what is the name? Influence of Arabic. I'm not sure, but I think many of you know about Ibn Sina. This is one of the healers that from a Middle East that is very famous, and surprisingly, his book is using in many of healer here in Europe. And we can go to the next slide, maybe. So what is my interest about the medicinal herbs in here, because I'm from East, and in East we are used to praise a lot of the herbal medicine, and not herbal, I mean we are used to praise of the West medicine and West method, and this is like a symbol of certain of level of life. But surprisingly, here in Europe, the people are willing to do all and to try all, and they have a specific clinic, a specific healer with a specific education that people went and doing their treatment or medication, and they are adopted into their daily life. And this is what makes me surprised, because I was thinking as the West people are so modern, they are into all what is advanced and all. But surprisingly, and also like what I hear Dr. Katmani presentation, here the kind of medicine or the kind of treatment is very popular and famous here, and people willing to that. And the most important, they have trust and they believe of the result. And I think this is a very high point, that when people believe, and somehow this will be connected with the result. So I think this is only like some medicinal herbs that I copy paste from internet, for like many like flowers, like the roots, like the leaves, many of the the herbal or the plants, the plant they are using, and they can use also not only as a powder, but they use it as a daily food for like salad and all. So next slide, please. So I think this is some of my I don't know. I wonder my wonder about people will buy this kind of products instead of the real of medicine, and going to the doctors is will be like last of option when people have a mild symptom of a sickness. Even after people went to the doctors, this is quite for me. This is quite what we call funny. The doctor will give a very simple, basic emphasizing that drink tea and sleep and eat correctly. So like the consumption of medicine is very, very limited unless that you have a special condition or chronicle. So then this kind of products, that is what people consume on their daily basis. And this is all with medicinal plant from Europe, yeah, or from any other Asia. Next slide, please. This is some topicals, like this is SMETs, this is like painkiller salve, a tea or a capsule, what they are using, or flowers. They are putting and integrated into any kind of products that they are consumed on daily life. And also, of course, it's combined with the healthy lifestyle that is very, very strong. That is the types of the food, the types of the gluten, the very good education. Since, like, for example, kids here, when you are in kindergarten, they are aware what kind of nutrition that they should have on daily basis. This is all part of the educational that the government campaign to prevent the chronic disease since a very early young age. So they know how to avoiding what is not good for their health. They knew that they need to take have a good intake for carbs, for example, and protein, and they need to burn calories, good sleep. We call this bewegung, yeah, sport or moving up your body. And this is already starting from a very early stage of age in here. So, and then drinking tea that is contain medicinal herbal that is good for health is also part of the lifestyle that I into the community in here and where I live in Germany, especially. Next slide. So the integrating European herbs into the healthy lifestyle, like what I mentioned before, there's special doctors or healers that they will combine the treatment with other of traditional treatment, like massage, like what Dr. Katmani said, that is a very, very now very popular here. The people is combined, and also in palliative with the people that is going to embrace their end of their life. This is also part of this. Is so all is more into east than into west, to be honest, what I look here. And then meditation is also part of the habits in here. That is a lot of disease that the chronicle that is lead by some stress, and burnout is become one of the trending disease topic here. That is, people can get burnout even in a very early age. People on the early age, that is, they are starting because the pressure is different, the expectation is different, the Punglichkeit or punctualism is a very standard here, and then this is tend to make people burn out so easily. So like exercising and meditation is part of the advice that is given to many patients that I saw in here. Next slide. So I would like to share about my community. Maybe I didn't have so many pictures here, but I have some media, social media. So the community itself is Jamu Gendong in Germany. It's a community to introduce Indonesian medicinal herbal products called Jamu, and I make the workshop. And surprisingly, many other community is very interest about these products that called Jamu, and I had a lot of interaction with many. I get a lot of invitation from for example, from university, from the young or from many of sport community like yoga, or people that is into this line of healthy balance and etc. So from me, it's like what I really want to share is that since I'm from East and I live in West, I would like to highlight that is West world, it's so into of East medicinal and treatment. So as East, don't stop to keep promoting and introducing to the world what is good from the East to the West, because we are really like not only step, but more one step ahead from in this industry. That is from me. And thank you again. And maybe thank you later.
Experts and colleagues, good afternoon. It's both a great honor and a pleasure to have this opportunity to share and exchange ideas with all of you online today. I'm a physician from the Department of Gynecology and the first teaching hospital of Tianjin University of TCM in China. The topic of my presentation today is herbal medicine treatment of metabolic disorders, which was assigned to me by the conference organizer. This will serve as a script for my PPT-based lecture. Okay, next one. Next slide. Okay, and today's lecture will mainly cover the following 4 parts. The first part focuses on the treatment of glucose metabolism disorders. The second part addresses purine metabolism disorders. In the third part, I will introduce a highly prevalent discussed disease in China, the treatment of obesity with TCM. Finally, I will give a brief summary. Okay, next one. Okay, now let's proceed to the first part, disorder of glucose metabolism disorder. Speaking of glucose metabolism disorders, they currently include patients with diabetes as well as those with pre-diabetes. Okay, next one. Next slide. Now let me see the overview of diabetes. The definition of chronic disease characterized by hypoglycemia resulting from absolute or relative deficiency in insulin secretion and impaired. The clinical manifestations are excessive thirst and fluid intake, frequent urination, increased appetite, and unexplained weight loss. Okay, next slide. Okay, let me see the TCM perspective on type 2 diabetes. Type 2 diabetes falls under the categories of spleen heat and function in TCM. The yellow emperor's inner canon first proposed the condition arises from indulgence in rich and fatty foods. Such individuals must frequently consume sweet and fatty foods. The fatty foods generate internal heat, while sweet foods cause abdominal distension. Thus, their chi flows upward, transforming into consumption. Consumption in the Western medicine is diabetes. Okay. Next letter. Next letter. Now, from this part, we can see the etiology in traditional Chinese medicine in diabetes. They including 4 parts. The first one is insufficient endowment. The second one is irregular eating habits. So irregular eating habits is the most important one, especially in modern society. Excessive eating and drinking can overwhelm the digestive capacity of the spleen and the stomach, leading to stagnation and accumulation of heat in the middle burner. The third one is excessive labor, and the last one is emotional disturbance. Okay, next letter. The pathogenesis in traditional Chinese medicine of the diabetes is depletion of yin fluids with dryness and heat predominating. The primarily affected organs are the lungs, stomach, and kidneys, which influence each other. Okay, the use of TCM to treat consumptive thirst has a long and profound history. As early as thousands of years, Chinese herbal medicine relatively remarkable clinical efficacy. The fundamental principles of and treatment based on the pattern differentiation. Therefore, for different patients, based on the comprehensive analysis through the 4 diagnostic methods, TCM integrates the characteristics of their symptoms and the signs to summarize different syndrome patterns. So the different clinical patterns are treated with distinct oral formulas. The following are the displays of those symptoms patterns and their corresponding formula. Let me see the follows. The first one is the liver qi stagnation with spleen deficiency. Maybe the patient will suffer with the syndrome such as fullness and distension in the flanks and ribs, abdominal, bloating, poor appetite. So the treatment principle is promoting liver and strengthen the spleen. The representative formula is Xiao Yao San. The second one is phlegm heat mutual entanglement syndrome. We use Xiao Xianxiong decoction to clear heat and resolve phlegm. The second one, the third one is intestinal damp heat syndrome. Maybe the patient will suffer dry mouth with thirst, possibly with halitosis, epigastric fullness, and distension. So the treatment principle is clearing heat and drain dampness. The representative formula is Gegenqinlian decoction. Okay, next letter. So the spleen stomach disharmony syndrome, maybe the patient will feel epigastric fullness and distension, dry mouth, poor appetite, abdominal distension and oppression, and digested food, loose stool or diarrhea. So the treatment principle is harmonizing the spleen and stomach. So we use Banxia Xixin decoction to treat this kind of patients. Next one is the liver stomach heat stagnation syndrome. We use Dachaihu decoction to clear heat and resolve phlegm. The next one is excessive heat injury body fluid syndrome. Maybe the manifestation are excessive thirst with frequent drink, increased appetite, and quick hunger, dry and shaved skin, and quick temper, dry and hot stools. The treatment principle is clearing heat and generate fluids. The formula is 白虎加参 decoction. Okay, next letter. Okay, the next one is deficiency of qi and yin syndrome. We use yuquan pill to tonify qi and nourishing yin. Maybe this kind of patients will feel fatigue and weakness, palpitation, shortness of breath, and reluctance to speak, dry throat and mouth. The next one is liver and kidney yin deficiency syndrome. We use qi di huang pill to nourishing the liver and kidney. Okay, next letter. The last one is yin yang deficiency syndrome. Maybe the patient will feel frequent urination, increased nocturnal urination, even drink and urination simultaneously, dry mouth and throat, salient complexion, soreness and weakness in the lower back and knee, fatigue. We use 金匮肾气 pill to nourish yin and warm yang. Okay, next one. Okay, next one. Okay, in addition to patent-based treatment in traditional Chinese medicine discussed above, modern pharmacological research has identified certain Chinese herbs that possess target hypoglycemic effects. For example, astragalus. Astragalus in Chinese is huangqi. Astragalus polysaccharides exhibit the highest concentration and most pronounced activity within astragalus, possessing multiple pharmaceutical effects, including immune modulation, cognitive enhancement, hypoglycemic action. Another one is Angelica in Chinese, Dangui. The anti-diabetic effects of Angelica essential oil may be mediated by inhibiting glucoside activity, regulating blood glucose level, and modulating inflammatory pathway. Next slide. Next slide. Okay. The third one is purine. Purine in Chinese is Gegen. Purine possesses the following effects: protecting pancreatic beta cells, counteracting oxidative stress, reducing the accumulation of inflammatory factors. The next one, the last one is 脚骨兰 in Chinese is Ganoderma pentaphylium. Ganoderma pentaphylium inhibits glucosidase activity, improve insulin resistance. Okay, next one. Okay, now let me see the second disease, the purine metabolism disorders. Okay, next one. Okay, first of all, let me see the overview of hyperuricemia and gout. The definition: hyperuricemia refers to a fasting serum uric acid level exceeding 420 in adults on a standard purine diet, as measured on 2 separate days. When urate crystals deposit in patients with hyperuricemia, it leads to arthritis. So the patient will maybe have the presentation such as sudden onset of redness, swelling, warmth, and pain in the single joint, such as the first joint of the foot, ankle, or knee. Okay, next slide. Now let me see the understanding of traditional Chinese medicine in hyperuricemia. Hyperuricemia and gout are metabolic disorder caused by purine metabolism dysfunction, falling under the category of B syndrome and joint diseases in TCM. The Su Wen treatise on B syndrome states when cold and dampness converge, they combine to form B syndrome. Next one. So in this part, let me see the TCM pattern differentiation and the treatment. The first one is damp turbidity internal retention syndrome. The patient may feel maybe obesity, heaviness, and fatigue in limbs, craving for rich and greasy food, greasy mouth with thirst, sticky stool. So the treatment principle is dry dampness and promote spleen function. The representative formula is 平胃散. The second one is the liver qi, stagnation with spleen deficiency syndrome. We use 柴胡疏肝散 to smooth the liver and promote spleen function. Maybe the patient will feel chest and flank discomfort, restlessness and poor sleep, epigastric fullness, and abdominal distension. The third one is damp heat obstructing the collateral syndrome. Or maybe the patient the joints are red, swollen, hot, and painful. Pressure exacerbates the pain while coldness brings relief. So as a treatment principle is clear heat, resolve dampness, unblock meridians, and relieve pain. So the representative formula is modified 寺庙散. Okay, next slide. The next one is kidney deficiency with turbidity obstruction syndrome. So we use 辟泻分清 decoction to tonify the kidney and promote urination. Next one is syndrome of turbidity and stasis obstructing the collaterals. Maybe the patient has the manifestation of joint swelling and pain, persistent and recurrent. Skin appears dark red or with localized induration and in severe case. Okay, the treatment principle is clearing turbidity and remove stasis, unblock collaterals, and relieve pain. So the representative formula is modified universal gout formula. Okay, next slide. The next one is kidney deficiency with turbidity and stagnation syndrome. So we use 寄生肾气 pill combined with 桂枝茯苓 pill with modification. So the treatment principle is tonify the kidneys to eliminate turbidity, promote blood circulation, to resolve stasis, and facilitate diuresis. Maybe this kind of syndrome, the patient may feel fatigue and soreness in the lower back, dull joint pain, and accompanied by hard limbs, swelling in the limbs. The next one is spleen kidney deficiency syndrome. The patient may feel fatigue and exhaustion, itching limbs, dull joint pain, and accompanied by hard limbs, abdominal distension with low stools. So the treatment principle is strengthen the spleen and nourish the kidney, dispel dampness, and transform turbidity. So the formula is 黄芪黄芪 decoction combined 辟泻分清 decoction. Next one. Now let me see the modern pharmacological research. The first one is Tuflin Chinese, Similasis, Glabry rhizoma. Yes, this kind of herbs can enhance the expression of organic onion transporter 1, OAT1 are indicated that those compounds exert a urine acid lowering effect by increasing the expression of the uric acid surrection protein, OAT1. The second one is 辟泻in Chinese, Similax, research on the therapeutic effect of total swelling from Similax of AGA model, right? Relieve that this kind of herbs can relieve the inflammatory factors and thereby elevate inflammatory responses. Okay, next slide. Next slide. Next one is plantain. Modern pharmacological research indicated that this 车前草 herbs possesses effects such as lowering blood uric acid levels, anti-inflammatory, and inhibiting oxidative activities. Last one is semen research has found that canorbs, its mechanism involving inhibition of oxidative activities, regulating of urinate transporter expression. Next slide. Okay, in this part, let me see the third disease, the obesity. Okay, first of all, let me see the definition. The World Health Organization defines obesity as abnormal or excessive fat accumulation that adversely affect health. The clinical manifestation is obesity, weight gain increase with circumference possible accompanied by complications such as hypertension and diabetes. Okay, next slide. As we know, obesity will give us bring a lot of complications such as diabetes. The higher the degree of obesity, the greater the risk of developing diabetes and type 2 diabetes. Among obese individuals, the prevalence rates of prediabetes and type 2 diabetes are 43.1% and 23%. The next one is cancer. Okay, next slide. Next one. Okay, thank you. There are four kind of herbs that can in traditional Chinese medicine. The etiology are four parts: the irregular eating habit, the emotional disturbance, the irregular work and rest pattern, and old and feeble. The first one is very important. The irregular eating habit. Excessive eat can impair the spleen and stomach's ability to transform and transport nutrients, leading to the accumulation of fat within the body as undigested food. Substances are converted into fatty deposits, resulting in obesity. Okay, next slide. There are four kinds of Chinese herbs that can relieve the obesity. So the first one is dampness resolving and phlegm resolving category. Second one is heat clearing and fire purging category. The third one is spleen tonifying and qi nourishing category. Last one is blood activity and stasis resolving category. The herbs such as Poria alisma can eliminate dampness from the body and reduce weight gain caused by phlegm dampness. So the herbs regulate spleen and stomach function, improve fluid metabolism, and alleviate body edema. Next slide. Next slide. Okay. So let me see the TCM pattern differentiation and the treatment. The first one is spleen deficiency with dampness obstruction syndrome. The patient is obesity, edema, headache with a sensation of fullness in the head, heaviness and fatigue in limbs, reluctance to speak and move. The treatment principle is strengthen the spleen and tonify qi, promote diuresis and drain dampness. The representative formula is 森林白术散. The second one is gastrointestinal heat syndrome. This kind of patient may suffer from the obesity, headache with dizziness, and thirst with preference to drink constipation. The treatment principles are clear and drain stomach heat, promote bowel movement, and eliminate turbidity. The representative formula is a 配连麻黄 decoction. The next letter. The third one is liver T stagnation syndrome. The representative formula is 逍遥散. We use this formula to smooth the liver and resolve depression, promote qi circulation, and transform phlegm. Maybe this kind of patient may suffer from obesity with soreness and discomfort in the chest and flanks, gastric distension and soreness. In women, irregular menstruation may occur. Insomnia with frequent dreams. Last one is spleen kidney yang deficiency syndrome. This kind of patient may feel obesity, may suffer from obesity, puffy swelling, aversion to cold, fatigue, and weakness, sore wrist and weak legs, abdominal tension, and soreness. So we use modified Zhenwu Tang to tonify the spleen and kidney and warm yang and promote diuresis. Okay, next one. Okay, let me see the modern pharmacological research. So first one is Poria. A modern pharmacological research indicates that Poria primarily contains active components such as triterpenes and polysaccharides. It exhibits function including lipid lowering and liver protection, inhibition of inflammatory responses. The second one in Chinese is Baizhu. This kind of herbs, this confirms that the Baizhu exerts therapeutic effects for weight reduction by regulating lipid metabolism, improving insulin resistance, and modulating the gut microbiota. Next slide. Alisma in Chinese is these herbs, you know, can reducing blood sugar, combating fatty liver disease, and exhibiting anti-inflammatory effects. The next one is Husada. Modern pharmacological research has revealed that Sanda primarily contains active components such as husarine acid, flavonols, and triterpenes components. This kind of components effects including regulating lipid metabolism, exhibiting antibacterial and anti-inflammatory properties, demonstrating anti-tumor activities, and modulating immune function. Okay, next one. Next letter. Now let me see the four parts: summary and outlook. You know, modern metabolic disorder diseases such as diabetes, hyperlipidemia, and obesity have become major threats to public health. So the conditions with their complex cost and require for long-term management. From the distinctive approach in TCM, both core principles are the holistic concept and the pattern differentiation and treatment. TCM does not view abnormalities in blood sugar or lipids merely as isolated laboratory readings, but rather as external manifestations of an internal imbalance within the body. Based on those principles, TCM has developed its unique therapeutic method by applying Chinese herbal medicine. It aims to regulate the body's yin-yang balance, thereby achieving the goal of treating the disease. So that's all. Thank you.
I like to have a question. I like to ask Professor Wang. Is this okay?
Okay, that's okay.
Okay.
Hello, Professor Wang. My name is Lisa. It's a very, it's very nice to hear about your presentation. I just would like to know, is this like people can register and doing the treatment in the clinic, or there's any certain of mechanism that we need to how to enroll in this treatment in the clinic.
You mean in China?
Yeah, in China.
Okay, in China, we accepted the decoction and the single herbs. We accepted this. We use some traditional method to treat the patient. For example, we use acupuncture and acupuncture, and we use massage and cupping method. I don't know why you can understand. Just like a cup, we use the fire to fire the air and the thing. I don't know how to express it. So
I think
we not only use the decoction. We use a lot of the traditional method to treat the patient with diabetes and other metabolic disorders. Okay.
Okay, and what if when people would like to want to do the treatment in the clinic, who they can contact?
Pardon?
Do they have who they can contact when people want to do the treatment in the clinic with the treatment that you just explained to us today? Which clinic that we can go and where and how we enroll and register ourselves?
Yeah. In China, in China, the traditional Chinese medicine, we have our hospital is very big. Maybe we have 3,000 beds in our hospital. We use the traditional Chinese medicine with Western medicine together. Okay, if you don't work in the hospital, maybe you can work in a clinic, personal clinic. Always, if the patient wants to see the doctor, you can go to the hospital or you can go to the personal clinic to receive the treatment if you want.
And this is this is in Beijing.
Not only in Beijing, but
Other city as well. Other big.
other cities. Yeah, other cities. Okay. Yeah.
Okay, thank you.
Welcome.
Okay, it's interesting the discussion between Miss Lisa and Professor Wang. Okay, there any question in the room? Maybe you can call your name and institution, please.
My name is Keiza, and I will ask to Dr. Kitmani, what is the main purpose of using this traditional medicine in relation to modern medicine? And I will ask to Miss Lisa too. Hi, Miss Lisa. I like to ask, how do Germans view traditional medicine, especially Jamu? Also, how well known is Jamu over there? Thank you.
Okay. Dr. Kathy or Mrs. Lisa? Oh, Dr. Kathy. Yes, you go first.
Okay, so for the non-communicable disease, traditional medicine is as the supportive role, but another disease like musculoskeletal disease, we are competitive with the Western medicine. Some cases using the traditional medicine is better than having only the medicine only. So in Thailand, the patient can choose what they want to receive, but the doctor will be checking up again and evaluating again. Thank you.
Thank you, Dr. Katie. So there is a checking again from the doctor. Yeah. Okay, next to Mrs. Lisa. I'm sorry, Miss Lisa. There's still mute on your microphone. No, there's no hearing. Your microphone is on the mute. Yes, okay.
Yeah. Can you hear me now? Okay.
Yeah.
So for Jamu now, there's a big progress that is a very popular in Europe. and many of company producing this medicine products under the name Jamu itself, because in the past, what ingredient that is in Jamu, it's combined into other products, but the Jamu name itself, which is the Indonesian brand, and we are already registered in the UNESCO, it's not known. But now there's a product of Jamu from Holland, for example, and also from Germany, and also from Belgium. So Jamu now it's already known as an Indonesian brand that contain medicine benefits, and this is not only applied as a drink but also applied in other products like topical products and pills and etc. And what is the second question again?
Yeah, there is a question there. Okay. Uh, Next question is there?
The lady that was the asking is it Jamu, and the other question?
Eh, please repeat the question from yeah, the question to Miss Lisa. Tolong ulangi pertanyaannya untuk Bu Lisa tadi yang terakhir.
How well known is Jamu over there?
Ulangi.
How well known Jamu in Germany?
Yes.
Oh,
Yes, like what, like I just mentioned before, Jamu is now known as Jamu, which is products that contain medicinal function and beneficial. And there's a products in the market that called Jamu that people can buy in pharmacies or in a shop. And also there's a certain of lifestyle that's supporting Jamu, that is including like healthy movement, for example, like yoga community, like Pilates, or any other sport mind balance community that is highlighting Jamu is part of the lifestyle. That is what is happening now in Europe. And as an Indonesian, I think this is a very good it's a very good point for all of us that the good of Jamu is known in the world now.
Thank you, Mrs. Lisa. So there is they call it jamu, right? Or herb, just herbs? They call it jamu, right?
Now Jamu, and this is what I'm campaigning. This is what I'm doing here. What I'm campaigning is like I would like that the Jamu name itself will be known as Indonesian brand. Like when we hear, for example, maybe kimchi. Yeah, okay, kimchi is a food, but Jamu itself is an Indonesian brand that we need to have a proper education about it to introduce it to the world.
Okay, thank you, Mrs. Lisa. Okay, we go to next
May I?
question. Yeah.
Thank you for the opportunity. Miss Lisa, I would like to introduce myself. My name is Sabdoratri. Now I'm studying in Diploma of Jamu, Poltekkes, Solo.
Yeah.
And now I have a Jamu company actually, not big one, but
Wow.
small. And then I do really interested that you are already, what's that? So in the word that Jamu, it's from Indonesia, right? So can I go to export to other country? How to way? Please teach us. Thank you.
I think to importing our products, it's very important to know the standard basic regulation of the product itself. And of course, there's many paperworks, but the most important is you need to be in many of exhibition.
Right, right.
Yeah, you go to
I'm
the
in Indonesia only. So, would you please the skill exhibition in the world. So which minimum, what's that? Cost, yeah, because we are the small one company, not the big one. So we can reach of opportunity.
Well, I'm not an expert in this business area,
Okay,
but
thank you.
yeah, but what I
Sorry.
can share about is there's a certain of like association
Uh-huh.
that is helping and regulates all these kind of events that people can promote their products in certain of events. I can separately giving the list of this kind of association.
Uh-huh.
And of course, there's also like a big foundation in Germany that you need to match the qualification.
Okay.
Yeah, for example, they have a certain standard for uh, importing uh, products with efficacious medicine result.
Okay.
Yeah, because there's a different standard of Indonesian or Asian food with European standard. That's what as I know. But I can separately send this to the committee, then you get the information from them.
Thank you. Before, can I know your contact, please, so I can direct contact to you if I have any product and then want to propose or something. Maybe you can help to reach to other company in the Holland or Germany. So maybe we getting in business. Can I know your contact, Miss Lisa?
Yeah, I will gladly to share my email address, then you can contact me there.
Okay, thank you so much. Thank you.
Yeah, you're welcome.
Okay, thank you for Ms. Sabrati. And there is any question from here, audience here? Or maybe we go to chat room. There is one question for Professor Wang Bin. Professor Wang, are you there?
Yeah, I'm here.
Yeah, there is one question from Mashito, from Traditional Medicine Erlangga University. I will ask to Professor Wang Bin, do you identify particular syndrome patterns related to obesity and diabetes in your clinical diagnosis? They have both some syndrome because in Indonesia, I found out that usually both obesity and diabetes have hit them syndrome. Do you identify
Can you
particular
repeat it?
syndrome?
Because
There
signal
is
is not a while. Okay. Can you
Do you
repeat it?
identify
Question?
from syndrome? This is from chatroom Zoom chatroom. There is one question. Do you identify particular syndrome patterns related to obesity and diabetes in your clinical diagnosis? If they have both same syndrome, because in Indonesia, I found out that usually both obesity and diabetes have hit them syndrome. Do you ever found that some syndrome between obesity and diabetes in your clinical?
Okay. Oh, I'm sorry. I can't get the question very well. But maybe if the patient suffer from the diabetes, the blood level is not very high. Maybe the patient have no symptoms. If the blood level is very high, maybe they will feel thirst, consumption, and loss of weight. But if you don't have if the blood level is not very high, we just treat the patient with the differentiation, the pattern differentiation, not depend on the sugar level of the blood. We just use the decoction to treat to resolve to to keep the balance of the yin and yang of the body, not just focus on the sugar level of the body. So if the patient with no symptoms, it's okay. We just use the herbs to treat the patient.
Okay.
I don't know. Okay.
Yeah, maybe there is some similar syndrome, diabetes and obesity in your clinical. Is it right? The answer?
Yeah.
Yeah. Okay. Okay. If there is any question. Okay. Ladies and gentlemen, we'll still have one or two questions. If there are no further questions, I will proceed to the closing remarks. We have reached to the end of second panel session. On behalf of committee, I would like to express my sincere gratitude to all our speakers. There is Dr. Kitmani Chungjiamdi, Mrs. Lisa Johan Schulz, and Professor Wang Bin. Thank you very much for your sharing your valuable knowledge and perspective with us today. I also would like to thank all participants for your attention and active participation. And I hope this session provides meaningful insight and inspire future collaboration in traditional medicine and wellness approaches for metabolic disorder management. And I hope we meet in another chance or another opportunity. Okay, with that, I officially close the second panel session. Thank you very much for our speakers once again. Have a wonderful day, and I hope everything we learned today can be used appropriately. Thank you.